segment is about follow-up care and what to watch for when you go home. When we send you home, it's recommended that we have a follow-up with your family doctor or pediatrician or midwife within the first 2 days of discharge. If we can't arrange that because it falls on a weekend, we will likely set up a pediatric ambulatory clinic appointment for you before you can see your doctor, and then you would have to book a doctor's appointment for like the Monday or the Tuesday after the weekend. The reason that we recommend this short-term follow-up is to catch any dehydration, weight loss, or jaundice that may be happening for your baby, or any other issues that may pop up quickly and have them addressed. At your first visit post-discharge, you should expect to have your baby weighed, and your doctor, all scales are different, but your doctor will be able to tell if there's any great weight loss. When they assess your baby, they'll be able to see if there's any dehydration happening, and whether your baby is treated there or readmitted to the hospital, or it's something that you can address at home. Those things will be addressed for you. So signs and symptoms of dehydration. What you want to look out for when you go home is that your baby is acting as normal. So if your baby is really lethargic, extra sleepy, hard to wake for feeds, just not acting how you know your baby is, those are the major indicators that something is going on. You also want to make sure that your baby is having the appropriate amount of pees and poops. So there's another segment that talks about elimination and how many pees and poops you should be expecting. So those are things that you can also find in the Blue Book if you can't remember exactly the appropriate amounts. But if baby's not having as many pees as is normal, or for the age of the baby, if the pee in the diaper is extremely concentrated, so if it's yellow or really dark yellow or orange, or even can be a little brick red in color, or the pee volumes are not a lot, so if your diapers aren't heavy that you're getting, baby will also probably have a dry mouth. So the inside of the mouth should be nice and moist, the tongue and the insides of the cheeks. So if you stick your finger inside and everything is nice and moist, baby has saliva that you can see, those are all good things. If the inside of the mouth is dry, then that's an indicator of dehydration. The other thing that we may see with dehydration is on this soft spot on your fontanelles on your baby. So there's a large one on the front of the head here and a smaller one here at the back. If you run your hand over your baby's head, it should just feel flat and soft. If the fontanelles are sunken in or bulging out, those are signs that something may be up with your baby. So you would have to have your baby assessed at that point. Either emergency, walk-in clinic, family doctor, or our clinic that's open. Infections. So little babies, newborn babies, are susceptible to bacteria and infections because they don't have an immune system that is as strong as ours is. So we have to watch them very closely. The first sign is usually the baby is lethargic, or you see a high temperature or a low temperature. So for temperature taking for your newborn, we recommend using an oral thermometer and using it under the arm. So you would place the tip deep in the armpit and hold the arm down to get an accurate reading. A normal newborn temperature is between 36.5 and 37.5. If you find your baby is warmer than 37.5 or cooler than 36.5, both of those can indicate infection, either a warm temperature or a cool temperature. So you would want to take steps to check and see if this is actually a fever or a low temperature. If the baby is reading on the warm side and is being snuggled or has a blanket on, try and take off a layer or lay the baby down, wait 15 minutes to half an hour and recheck the temperature. If the temperature has resolved and it's within normal limits, then we're good. And if it hasn't, a fever won't respond to that change that you've made, then you want to have your baby assessed immediately. Fevers and low temperatures are not something that can wait. Babies get sick very quickly, so at home it's something that you want to have addressed. So take baby again to your doctor, to emergency, to a walk-in clinic, have somewhere